This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Question from Mimi. I'm currently testing my urinary progesterone levels using an at-home device because I have a short luteal phase of 9 to 10 days. My progesterone levels are normal. Do you believe that short luteal phases prevent pregnancy? Would you prescribe progesterone support because of the short length of the luteal phase, even though the urinary levels are normal? Thanks so much for any advice you have.
So urinary progesterone tests are okay, but don't tell the whole story. I'd be more interested in tracking a cycle with ultrasound, doing blood tests to establish ovulation, and then looking at the luteal phase, perhaps with progesterone levels in the blood, which are more reflective of what's going on in the uterus. And maybe even doing a curette, taking a sample of the lining of the womb when we expect you to be at the time of implantation, which should be 5 or 6 days after ovulation, and seeing whether the lining of the womb is in synchrony. Every day that the lining of the womb is exposed to progesterone, it changes its structure. And based upon that, and this goes back to 1950, a man called Noyes from America documented daily changes in the endometrium. And so using those criteria, we can actually find out whether the endometrium is failing early, for instance, and that would cause a luteal phase to be short. And what would I do about it? Either using progesterone tablets in the vagina or pessaries, or promoting the normal place where progesterone is produced, it's called the corpus luteum, in the ovary, by giving you probably 3 injections of pregnancy hormone, which push that progesterone, that corpus luteum, to produce more progesterone. And that may work. There are many people who don't believe in a short luteal phase. I certainly do. It's still very uncommon to have it repeatedly happening. I did some work 20 years ago now where we showed in normal women there's a poor level of progesterone in about 1 in 12 menstrual cycles. So, basically all women have, from time to time, have a poor luteal phase. But there is a small group of women who it's a consistent problem.
Prof, we have a question from Kirby, and she says, do you have any recommendations for IVF clinics in Perth, WA at all? I'm tossing up if going private is going to give me a better result than bulk billing.
Well, going back to my criteria of how to pick a good clinic, in Western Australia, the subspecialists, the ones that I know of, 2 of them are at fertility specialists, I think it's called, Professor Hart and Tamara Hunter. That's where I would go if I was going to have IVF in Western Australia.
Prof, question from Samantha Corbett. She's having 20 follicles and 80% immature as a result of incorrect protocol or PCO, 4 stem cycles done. I've changed 4 doctors. And then she says, I'd like to add, I do not have PCOS, only PCO. Do you recommend ovarian drilling? I've had a few implantation failures. And Mimi says, great, thanks, Prof. I appreciate it so much. Thanks for the education.
I certainly do ovarian drilling when we're not doing well with eggs collected, when you basically overstimulate because of the PCO. And that applies to either PCO or PCOS. I suspect you've got a high anti-Müllerian hormone level, which goes along with that. I've certainly had patients who have done poorly in that scenario, and we've done ovarian drilling and they've fallen pregnant spontaneously. In fact, one of the patients who we just talked about that was being complimentary earlier in this program had exactly that, ovarian drilling and then a pregnancy subsequent to it. Obviously, as an academic who spent my life teaching medical students, young doctors, and I have a great belief that talking to patients, teaching them about why. I had a patient this week who came to me from a low-cost clinic, and her first complaint was no one said anything to me or explained anything to me. And that's the big advantage of having good people with time to actually go through the reasons why we do things. I enjoy doing it and feel can be helpful.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.